Hey, welcome to The Explainer. Today we're diving into something pretty wild, a rare condition called acromegaly. It's basically what happens when your body's growth signals just forget to turn off, long after they were supposed to. I mean, think about it. Our bodies are amazing, right? They have this built-in clock for growing, knowing exactly when to start, and, just as crucial, when to hit the brakes. But what if that stop signal just breaks? What happens when parts of you keep on growing, even when you're a full-grown adult? Well, that's where a condition called acromegaly comes in. It's a rare thing, and it's all about your body getting flooded with way too much growth hormone when you're an adult. And no, we're not talking about a late growth spurt to make you taller. This is a totally different kind of growth. Okay, so where does all this even start? To really get acromegaly, we've got to trace it back to the source. And believe it or not, it all comes down to this tiny but super powerful gland that's basically the body's mission control for growth. Let me introduce you to the pituitary gland. It's this little thing tucked away at the base of your brain, and it's like the master switch for all things growth. Its main gig is to pump out growth hormone, telling your body how and when to get bigger and stronger. But what happens if that switch gets jammed in the on position? So, in pretty much every case of acromegaly, the bad guy is something called a pituitary adenoma. Now, that sounds scary, but it's a benign tumor, meaning it isn't cancerous, that grows right on the gland. This little tumor basically hijacks the pituitary, forcing it to just pump out insane amounts of growth hormone. And yeah, you guessed it, the bigger the tumor gets, the more hormone it cranks out. Okay, so here's the kicker. Timing is everything. If this hormone flood happens when you're a kid, before the growth plates at the end of your bones have closed up, it leads to gigantism, making someone incredibly tall. But if it happens when you're an adult, after those plates are all fused and done growing, your body can't get any taller. So instead, all that extra hormone starts making your existing bones and tissues get thicker and bigger, and that is acromegaly. So what does this kind of overgrowth actually look like in a person? Well, the thing about acromegaly is that it's not some sudden change. It's a really slow, gradual transformation, one that can take years, even decades, before it's really obvious. Yeah, and because it happens so slowly, a lot of the time, people just don't notice it for a long, long time. Usually someone's in their 30s or 40s before the signs are clear enough for a doctor to say, hey, this is what's going on. It might start with something as simple as, my wedding ring doesn't fit anymore, or noticing you have to go up a shoe size. And it's not just about what you can see on the outside. There's a ton going on inside the body too. All that extra growth hormone can cause some really serious problems, like feeling weak all the time, getting that pins and needles feeling that's called paresthesia, and even things like high blood pressure and heart disease. But the classic signs, the ones you can see, are really distinct once you know what to look for. The jaw bones, that's your upper and lower jaw, start getting bigger. This literally changes the shape of a person's face. Their lips get thicker, their skin can get kind of coarse, and one of the biggest clues, their teeth start to spread apart as the jaw expands. And take a look at this. You can see it so clearly here. One of the most telltale signs. See those gaps forming between the teeth? That spacing is happening because the jawbone itself is actually growing and pushing the teeth apart. It's a really powerful visual for how the condition progresses. All right, so once these signs start to pop up and get noticed, how do doctors actually confirm it's acromegaly? And, probably the most important question, what can they do about it? How do you get that hormonal balance back on track? Getting the diagnosis is actually pretty straightforward. First, doctors use an MRI or a CT scan to get a look at the pituitary gland. They're looking for that adenoma, that little tumor. Then, a simple blood test can show if the growth hormone levels are way, way higher than they should be. You put those two pieces together, and you've got a really clear picture. When it comes to treatment, there's usually a three-part game plan. Step 1, and the main line of attack, is surgery. Doctors go in, often right through the nose, in a procedure called a transsphenoidal removal to take out the tumor. Now, if they can't get all of it, step 2 might be radiotherapy to shrink whatever is left. And finally, step 3 is medication. There are drugs that can help get those growth hormone levels under control, and they're often used to support the other treatments. At the end of the day, the goal for all of these treatments is really simple. First, you got to stop the body from making too much growth hormone. And second, you need to relieve any pressure that tumor might be putting on the brain. If you can do that, you stop the condition from getting any worse and really help manage the symptoms. Acromegaly is just such a wild reminder of how a tiny little gland, seriously, no bigger than a pea, can have this huge, life-changing impact on the entire body. It really makes you stop and think, doesn't it? What other incredible, powerful jobs are these tiny glands doing inside of us right now, every single day? Something to chew on. Thanks for joining us for this explainer.